Hello everybody, welcome to Medical Coding Bunnies. And today in this video, we're going to talk about FNA Biopsy CPT codes. And I'm going to show you the easiest way to remember FNA Biopsy CPT codes without memorizing the entire CPT book. So let's get started. What is an FNA biopsy? The easiest way to remember FNA is to think tiny needle, tiny cells. FNA means fine needle aspiration. It uses a very thin needle to collect small cells or fluid, while core biopsy uses a larger needle to collect a bigger piece of tissue. Skinny needle means FNA biopsy. Bigger needle means core biopsy. And here is the biggest CPT trick. The critical question to ask before coding any FNA biopsy. Did the doctor use imaging guidance to help guide the needle? If the doctor did not use any imaging guidance, code 10021. If imaging guidance is used, code depends on imaging type. And this one question determines your entire coding path. In simple, think of imaging as a GPS. Imaging guidance is like a GPS helping the doctor guide the needle to exactly the right spot. Just as GPS uses satellites to pinpoint your location, imaging uses technology to visualize the target. Different imaging types correspond to different CPT families. For ultrasound, we use 10005, fluoroscopic 10007, for CT 10009, and for MRI 10011. So here's an easy number memory trick. Ultrasound 10005, fluoroscopic 10007, CT 10009, and MRI 10011. Think of the numbers climbing upward like stairs: 5, 7, 9, 11. Each imaging type gets its own code and they go up in a predictable pattern. This stair-step trick makes it impossible to forget which code goes with which imaging guidance. Do you have more than one lesion to code? So when coding multiple lesions, the first lesion uses the primary CPT code. Each additional lesion uses an add-on code. So remember, the first lesion starts the job and the extra lesions add to it. This simple rule keeps your coding accurate and compliant. And here's an easy add-on code trick. 10005 with 10006, 1007 with 1008, 1009 with 10010, 10011 with 10012. Here's the simple pattern. Odd numbers start the procedure for the first lesion, and even numbers are the add-on codes for additional lesions. Just add 1 to get your add-on code. And here's a common coding mistake. FNA biopsy CPT codes already include imaging guidance. Do not separately bill for the imaging component when it's bundled into the procedure. No separate ultrasound billing, no separate CT billing, no separate fluoroscopy or MRI billing. Everything is included. So here's the final easy summary of what we learned. Skinny needle means FNA biopsy. First ask, was imaging guidance used? Stair-step pattern 5, 7, 9, 11. Odd equals first lesion, even equals add-ons. That's the easiest way to simplify FNA biopsy CPT coding. Remember these 4 tricks and you'll never struggle with FNA codes again. Thanks for watching. Give it a like and subscribe to Medical Coding Bunnies. Bye.